So I'd like to begin by thanking everybody for coming, thanking everybody, more importantly, for the work they've put in over the last 6 or 9 months on this strategic plan. This is the formal rollout. It will go up on the web today as well. There's a document that'll go up on the web. It's about 110 pages long. So we won't be able to go through everything verbally with you, but I want to be able to give you an overview. I want to particularly thank Tom Kelly. Tom, if you can stand up and be embarrassed, because Tom is the one who actually did most of this work running the program. So what I'm going to be talking about today is the RBHS strategic plan, first talking about the planning process, and then talking about spending most of the time describing the plan itself. And again, I'd like to thank everybody. There are literally thousands of people who are involved in pulling this together, as you'll hear about, especially the over 500 people who are involved in the 32 work groups and the 24 people who are on the steering committee, led by Bob DiPaolo as well. So I'd like to thank all of the people involved. People were great about putting a lot of time and very broad involvement. So again, the strategic plan. I'll begin with the university-wide strategic plan because this happened in the year, roughly a year before we started, and really is the basis for what we then take to individual divisions. So the overall university plan, the aspiration is to be broadly recognized as among the nation's leading public universities, preeminent in research, excellent in teaching, and committed to community. 5 integrating themes were chosen: cultures, diversity, and equality, both locally and globally; improving the health and wellness of individuals and populations; creating a sustainable world through innovation, engineering, and technology; educating involving citizens and effective leaders for a dynamic world; and creative expression in the human experience. There were 4 strategic priorities under that: envisioning tomorrow's university, building faculty excellence, transforming the student experience, and enhancing our public prominence. And then the foundational elements were chosen to be strong core of sciences and humanities, inclusive, diverse, and cohesive culture, effective and efficient infrastructure and staff, financial resources sufficient to fund our aspirations, and robust shared governance, academic freedom, and effective communication. This was the basis that we inherited as we began our strategic plan. The university document is obviously available in much more detail. Parenthetically, I should add that the full 110-page document of ours will go up on the web today. There's also hard copy, fancy-looking versions that are in production. They'll be out in December before all of that is ready. But this was our basis. So our strategic planning goals, the university did its overall plan with the idea that it would turn over to the 4 divisions, making it more concrete and more specific about how these things were to be implemented. So the first was to enable RBHS to achieve excellence and integration across all health professions, schools, and units. Second was to integrate with non-RBHS Rutgers and across schools, translating university-wide priorities into the unique context for RBHS. Third was to build on our existing strengths. And fourth was to recommend a strategic plan to guide RBHS for the next 5 years. There's multiple strategies that were invoked in this 3 slides of this. The first was a listening tour that I began of all the RBHS units before I began here. So before I started December 1st, in the months before that, I spent 1 day a week visiting each of the different programs that are within RBHS. Second was analysis of data collected during the university strategic planning process. An enormous amount of data was collected that we analyzed in turn as specifically relevant to RBHS. Third were meetings with Camden, New Brunswick, and Newark community members. Fourth were consultations with state and federal legislators. Fifth were meetings with clinical program directors, primary hospital leaders, and potential hospital system leaders. Continuing on, there are consultations with RBHS deans and directors, the RBHS Faculty Council, the Board of Trustees, the Board of Governors, the Board's Health Affairs Committee, other Rutgers chancellors, and President Barchi. There also was a strategic planning steering committee appointed, 24 members, again chaired by Bob DiPaolo of CINJ. to consider the RBHS mission and mandate, to consider the Rutgers-wide strategic plan, to consider the future of healthcare. And we had a seminar, a speaker series, 7 speakers, half internal, half external, roughly once a month during this process, coming in and talking about how healthcare is changing going forward. 2 surveys, and we'll talk about those. The steering committee reviewed the results of those surveys, and a follow-up survey that was conducted as well. They formed working groups, identifying co-chairs and suggesting members for those groups, and we'll talk much more about the working groups. And finally submitted recommendations for signature programs, educational initiatives, and enabling structures. The goal in terms of academic initiatives are shown here. The signature programs are seen as areas that are current strengths and where we could become one of the best in the country within 5 years. And an underlying philosophy here is that from a research point of view, if you really try to cover the bases, you end up mediocre in everything. And so the idea was to identify those areas in which we already had substantial strength, where we could be among the best in the country in 5 years, and these would be the areas that RBHS would be known for. Doesn't mean that other research would end, obviously, and this is a living document. It'll be adjusted along the way, and obviously come 5 years from now, the next strategic plan could well identify different areas of strength to be developed. But these are the areas that would be the primary focus of research investment over the next 5 years. Complementary programs were areas that were thought not to currently be of sufficient strength so that we could be among the best in the country in 5 years, but would be essential to the growth and development of our signature programs and are critical to our mission. Educational initiatives, areas that specific RBHS-wide programs selected for development. Obviously, each school has its own educational mission that doesn't get replaced by this at all. This is looking for educational initiatives that cut across schools. And enabling structures that needed infrastructure to support these selected programs and critical for our aspirations. So the working groups we formed correspondingly were 3 types: potential signature programs, potential educational initiatives, and potential enabling structures, and we'll talk much more about those. So the process of this, let's see if I can do this. If I can do this with the pointer, so people remotely can see it as well. We began in December reviewing the Rutgers-wide and existing school strategic plans, established the steering committee. That was the RBHS kickoff. Data collection began in the beginning of January with an RBHS survey on goals and issues that I'll briefly show you. In February, a Rutgers Universitywide, faculty-wide survey on areas of interest. Those surveys led to the steering committee identifying potential RBHS initiatives in March, formation of the working groups. Those working groups identified their proposals over the next 6 weeks, put a lot of work in over a short time period. They basically had a draft of reports back in a month. The steering committee reviewed those drafts and gave them feedback, and then had the final reports in 2 weeks after that. The steering committee and I prepared the plan in response to that feedback, and then over the summer the plan was widely reviewed across RBHS and Rutgers-wide as well, and then resulting in the final plan. And then I should say in the course of the fall, it's been reviewed by multiple Board of Governors, Board of Trustees committees as well. So what is our strategic plan going forward? First, we began with a survey across RBHS, faculty, staff, and students, and had impressively over 3,500 responses, focusing on goals, resources, and concerns, trying to identify what do people want RBHS to be, what do they want it to look like in the future. The people who answered are shown here in terms of the current position. 32% were faculty. The second biggest group, I guess, were administrative staff, then research staff, full-time students, and so on. So again, 34-47 responses. I'll show you only one small bit of those data. There's a huge amount of data. It's all on the web if you want to dig through and find out much more detail about what the survey showed. What you can, when asked about what they thought our primary goals should be, so there's multiple different, you can answer yes to multiple different answers here, not just the primary goal, but what our primary goals should be. 70% answered clinical care, 63% research, 62% education, 52% community service. Very large interest in community service in this community. 47% concerned about reputation, then other and no response. That was the January survey, and again, there's dramatically more data than this available that you can find on the web. February, we sent a survey to all Rutgers faculty. So this is just faculty, but not just RBHS, of course, all of Rutgers. The focus was on potential signature areas, educational initiatives, service initiatives, and enabling structures. And again, the goal here was really to ask people what were the areas they were working in themselves. Where were they working in? What do they consider most important? Where were they funded in? Data that we validated from NIH Reporter and other sources. Where are the areas of our potential strengths? To be clear, when I did my listening tour, I ended up with, I don't remember, it was a 90-something areas. I asked that question to each of the groups. Everybody, of course, volunteered their area as the potential strength, ended up with 90-some-odd strengths, 90-some-odd potential areas. From the dean's directors and then from the steering committee, that got up to, I think it was like 160 different potential areas. That's what went out in the questionnaire. Again, with recognition, you can't force faculty to work in areas that are not their areas of interest. The question is, where are our areas of interest? Where are our strengths? And that was the goals that we were looking for in this survey. I'm delighted that fully one-third, over 1,500 faculty responded, and fully one-third of those were outside RBHS. So these are a lot of non-RBHS Rutgers faculty who are interested in health, who want to participate with us in these areas. And that was central to what we put together here. Again, to give you a sense of the respondents' primary appointments, roughly half were listed as RBHS schools, 42% New Brunswick, smaller numbers from Newark, and the smallest numbers from Camden, not surprising because the numbers of faculty in those divisions are smaller as well. Out of these surveys came, firstly, an aspiration statement, which we got a lot of feedback on, edited, and then ultimately there was a third survey where people got to vote endorsing the changed version. So this is the aspiration statement that we will be going forward with. RBHS will be recognized as one of the best academic health centers in the U.S., known for its education, research, clinical care, and commitment to improving access to healthcare and reducing healthcare disparities. This will be achieved through dedication to elevated standards of excellence and innovation, interprofessional collaboration and integration, and deep engagement with the community. And I have to say, one of the strong feedback we got in the initial draft, change between the initial draft and this, was elevating the community focus, which clearly was of interest to a lot of people, and we'd missed it in the original draft. And a lot of people gave us that feedback, and it got incorporated accordingly. Identity statement, again, a draft early on, went to through the survey process, edited based on comments that we got in the survey process, and then endorsed ultimately by the third survey. RBHS leads our Rutgers efforts to be a state, national, and international leader in the biomedical and health sciences and their related professions. The approach incorporates insights from laboratory sciences and the clinical, behavioral, public health, and social sciences, as well as from non-healthcare disciplines, including business, economics, engineering, law, the arts, and humanities. RBHS will advance population-based, value-driven healthcare by building on its recognized clinical and research excellence, engaging with local and global communities, taking advantage of and strengthening its uniquely diverse workforce, and realizing interprofessional synergies among its schools and institutes. Further, RBHS will strengthen its many professional ties with state and federal governments and foster new public-private partnerships with industries critical and vital to New Jersey's future. We then moved, and again, over 500 faculty participated from across Rutgers in these 32 work groups. And the numbers in each category are shown here. Each work group had 2 co-chairs from different campuses and different schools, and included representatives from all the different participating campuses and schools as well. So these were the potential signature area work groups. Their charge was to build signature programs. Our objective, what we were looking for, was signature programs across RBHS that have the potential to become the best in the nation in the next 5 years. So again, to emphasize, this doesn't mean there wouldn't be strengths developed within each school and within each division institute program separate from this. This is looking for the RBHS-wide strengths, that there's interest across our multiple schools and across our multiple institutes as part of that. These are the areas that we formed work groups in. Again, the 32 different work groups, multiple campuses represented in each of them, and looking for, and each of them was armed with a lot of data about where we were publishing, how much we were publishing, how many grants we had in these areas, and so on, looking for the areas that we already had as our strengths. These are the potential educational initiatives. These are different. These are looking for initiatives that have the potential to enhance educational and training programs across RBHS. So again, it doesn't take away at all from the educational activities that each school needs to continue to do for its professional needs. Our focus here was looking at inter-school programs and what we can do and should be doing across different schools. So looking at novel educational approaches, interprofessional education, undergraduate health-related education, leadership training, undergraduate or underrepresented minority pipeline programs, new degree, joint degree programs, and professional continuing education. And finally, enabling structures. The objective was to identify the infrastructure needed to support signature programs and educational initiatives. And again, financial opportunities and development, advancing institutional stature, the roles of centers and institutes, reorganizing the basic sciences, and faculty retention. So this really knits everything together. Our focus was signature programs, complementary programs, educational initiatives, clinical initiatives. I didn't show you the structure underpinning that, but I'll show you some of the recommendations emerging from that. Community service activities, a focus on integration, enabling structures, and how to fund the strategic plan. All tied together in the RBHS strategic plan. And again, 110 pages that I'll try to briefly summarize for you some of the highlights of now. So first, the signature programs. There are 4 signature programs that we chose. One was cancer, including within that tobacco research. One was environmental and occupational health. One was infection and inflammation, with particular strengths on host microbe interactions, immunopathology, and global health related to infection and inflammation. And one was neuroscience, neurodevelopment disorders, degeneration and nervous system injury, cognitive and sensory disorders, and motivational disorders. These are all areas in which we had substantial strength already, not coincidentally, perhaps all areas that we had existing institutes or one that had just been formed in neuroscience, and all areas that we thought that with investment we could be among the best in the country within 5 years. The last signature area we called an emerging signature area, and this was community health and health systems. And that's because as we went through this from a working group point of view, we didn't have sufficient strength already in terms of funded research grants where we think we could be among the best in the next 5 years. On the other hand, there was enormous interest among the faculty in these areas, and it's also pivotal to where this organization needs to go forward, going forward. So from a mission point of view, from a faculty area point of view, this is clearly an area that we need to be investing in and building going forward, but we didn't think within 5 years we'd necessarily be one of the best in the country, which is why we referred to it as an emerging signature program. So to talk about each of them in a little bit of detail, under cancer, the goal was to enhance team science, collaboration, and multi-investigator projects, to recruit faculty, to expand CINJ from New Brunswick to Newark and statewide, to build shared resources, and to, in particular, again, to include tobacco research, which is a small but very, very strong program, and already probably one of the best programs in the country. Second is environmental occupational health. The goal there is firstly to appoint a visionary leader for EOC, and the plan is to go forward with that recruitment once we have a School of Public Health dean in place, which we want as involved in the EOC recruitment. to establish a university-wide committee focusing on environmental and occupational health. And this really goes to, and we'll talk a little bit more later about centers and institutes in general. Part of the reason the centers and institutes are so strong is they've been very strong silos. Where we want to see them move to in this new strategic plan is to become university-wide entities. So EOC, for example, is extremely strong in the people in that building. But we want EOC to really be the focus of environmental and occupational health across the whole university. Also including New Brunswick, also including Newark, also including Camden. We really to be, not to undercut what's in the building, which needs to be built and strengthened even further clearly, but really to take advantage of the enormous interest in environmental and occupational health across this very large university. The same is true for cancer that we talked about before. CINJ really needs to be a university-wide structure reaching across the multiple campuses and across the entire state. Infection, inflammation, an enormous strength now in Newark, with strength elsewhere on campus, on our different campuses as well. A focus on host microbe interactions, immunopathology, and global health. The goal is to initiate collaborative relationships, including with industry, recruit faculty, increase multi-investigator grants, and develop new core facilities. And again, there's a lot more detail under each of these bullets in the 110-page document, which I'd encourage you to go through if you're interested. Last of the signature areas is neuroscience. The goal is first to recruit a Brain Health Institute director to lead this program, and in fact, that's already been done. He'll be arriving in the next few months. Gary Aston Jones, who's now from Medical University of South Carolina, to focus on neurodevelopmental disorders, including autism, an enormous strength here on campus. In autism, it came out of the neuroscience work group. It also came out of the child development work group. Two separate work groups, both recommending the development of autism, where there's a lot of faculty interested, but no one has pulled it together. The whole right now is less than the sum of the parts because of the lack of coordination. New Jersey has the highest prevalence of autism in the country. Partly that's probably artifactual because it has so many services for people who are autistic that people move here in order to take advantage of those services. But one of multiple enormous strengths here. Neurodegeneration as another, nervous system injury, cognitive and sensory disorders, motivational disorders, all areas that are strengths here that if we get people working together and expand those faculty are enormous opportunities. The neuroscience program goals are to create research programs focused on the biologic underpinnings of the healthy central nervous system function and dysfunction associated with the focus area disorders, to develop new treatments for the focus area disorders, and to establish a rich neuroscience resource for New Jersey. Finally, community and healthcare systems. First slide of two on this emerging signature area. To create community health and health systems working group, sort of beginning to coordinate the activities across the campuses, to identify and implement metrics to compare Rutgers to other institutions, to identify and pursue funding opportunities, to engage with local communities and practice and policy audiences, to identify and implement strategies for RBHS to become a learning healthcare system, to build partnerships with other health delivery systems and networks to engage in collaborative work, to develop and evaluate the most promising and feasible conceptual approaches for promoting population health and delivery systems innovation, to pursue other capacity building efforts based on lessons from assessment of aspirational peer institutions and other initial activities. So let me move on and talk about the complementary programs. There are 4 complementary programs that were chosen. And again, as a reminder, these are all areas that we thought were critically important to our mission and to the other signature areas, but we weren't in a position that we would necessarily be one of the best in the country within 5 years. So one of them is clinical research, one of them is drug development, one of them is informatics, and one of them is public health, including within that global health. So again, not saying global health is part of the School of Public Health. Obviously it is, but most of the other schools are interested in global health as well. And in fact, most of the other schools are interested in public health as well. And so we'll be looking for interfaces. So for example, clinical research in cancer, clinical research in neuroscience, drug development in cancer and neuroscience, and so on. So the areas we will particularly be looking for focus on is the things that interface between them. Obviously environmental health and public health accordingly. So which is part of why I think the new public health dean needs to be integrally involved in the selection of the new associate, the new EOC director. So this is seen as a matrix, not organizationally, but programmatically, where the signature areas will be the 4 or 5 I showed you before, and the complementary areas will be the areas that we will be looking to develop. Clearly we want to get clinical research to the point that we can apply for and successfully compete for and get a CTSA, for example, as part of that. But we'll be specifically looking to focus the investments in these complementary programs in the areas of the signature areas to the degree that works. Educational initiatives. A series of 7 work groups, as I mentioned, were focused on for educational initiatives. Some of these ultimately will be taken forward on an RBHS level, and some of them will be taken forward at other university levels. So the ones with asterisks are the ones that will be managed by RBHS. Novel approaches to teaching and interprofessional education will be particularly led on an RBHS level, and particularly by the Vice Chancellor for Interprofessional Education. Undergraduate health-related education is something we clearly care a lot about. That is not for professional undergraduates, but for the 65,000 Rutgers undergraduates. But we thought that those initiatives should really come out of the School of Arts and Sciences and the other chancellors working with our schools, rather than that being an RBHS level initiative. Underrepresented minority pipeline programs and leadership training programs are programs that are major initiatives in the Rutgers University-wide strategic plan. So we will participate very actively in that, but there's no reason for us to duplicate what they're doing on a university level, but rather we will participate actively with what the rest of the university is doing at that level. Joint degree programs, again, we thought were more appropriate as a school-to-school activity rather than our RBHS activity. We'll help account for it, put listings of them on the web, encourage it, but really the people who are going to be leading that are going to be school activities. And finally, professional continuing education programs. Right now we have a funny structure where each of our separate professional schools has its own separate continuing education programs, including separately our 2 medical schools. In addition, there's an RBHS-wide level. So we have competition on multiple levels all within our organization, which doesn't make any sense. We need to rationalize that structure and have people working in teams and in groups. The actual place that will sit remains to be finalized, but probably it'll be within the schools rather than within RBHS in general. Lastly, clinical initiatives, and there are multiple different clinical initiatives that are underway. I'll just talk about a couple of them very briefly. One of them is branding. We have a study underway looking at how we want to brand ourselves. Obviously, legally, we are Rutgers Biomedical and Health Sciences. That is our identity by state law. Nobody knows what that means. In the state, it is invisible. The marketing people did an interesting study looking at the reputation both within New Jersey and nationwide at Robert Wood Johnson Medical School, New Jersey Medical School, and Rutgers Medical School. Rutgers Medical School had a much better reputation. Of course, there is no Rutgers Medical School. And so, we clearly need to get our act together from a branding point of view and have a process underway to think about how to properly brand ourselves in a way that will get known and will recognize the statewide powerhouse entity that we will be evolving into and have a level of visibility that will begin attracting referrals from elsewhere rather than now where too many patients go elsewhere instead. Clinical partnerships, we are actively involved in restructuring our partnerships, particularly here with Robert Wood Johnson University Hospital, with which we have developed a very different relationship where they really become terrific partners. Hopefully they'd say the same thing. And really a new engagement with them. We're we're very close to signing a new master affiliation agreement with them as well, a new funding structure with them as well as part of it, and a totally different partnership with our primary hospital partner here. Primary partner in Newark, as you all know, is University Hospital. That too is in the process of a lot of changes, as there's an effort underway to look at how to rationalize hospital care in Newark in general, which right now is overbedded, and multiple hospitals each losing money and each sort of half full. And that needs to be restructured in general. And then with that, the restructuring both pieces vis-a-vis us. Accountable Care Organization, as many of you know, due to the leadership of Altaia and the hospital leadership jointly, we have Robert Wood Johnson Partners as an Accountable Care Organization. We've also put in place applications for 2 Medicaid ACOs, one in New Brunswick, one in Newark. These needed to be regional, and those are in partnership with other healthcare providers within that region. Clearly, the future of healthcare is population care, and that effort really is the point of the spear, so to speak, in leading us forward that way. Patient access initiative, certainly this group, this audience knows very well the major effort we have underway in order to restructure the faculty practice here and increase patients' access to physicians here at Robert Wood Johnson Medical School in particular. And finally, a new multi-professional, multi-school faculty practice plan. This was an effort originally led out of Newark, where the practice plan there, they don't have one practice plan, they have 18 in the medical school, 18 separate departmental practice plans. They realized that doesn't make sense. They need to bring it together. It's very inefficient. As long as they were bringing it together, came up with this very creative idea. This is before I started, of let's have it multi-professional. It will be unique in the country as far as we know. Multi-professional, including nursing, including physician's assistants, including dentistry, and including pharmacy, all together in one practice plan. And now that RBHS exists, potentially including Robert Wood Johnson Medical School as well. So we're far along in the process of having a consultant come in to sort of help us design what may be a new structure for a faculty practice plan across all of RBHS, rather than everything being separate. Other community service activities, there are many included within the signature programs, educational initiatives, and clinical initiatives, and I'd refer people again back to the main text to be able to see that. There are others provided by RBHS school centers, institutes, and UBHC, our behavioral health care unit, and others to be considered for development via the Community Health and Health Systems Emerging Signature Program. And again, much more detail in the document if you want to read up and see that detail. Lots of examples now of integration within RBHS, and let me just talk about a few of them. Obviously, the College of Nursing and the School of Nursing merged on July 1st, 2014 to form the Rutgers School of Nursing. In addition, there's been a reorganization of the School of Public Health, which has occurred and planned prior to launching the search for the new dean. So let me be more concrete there. The School of Public Health had few of its own faculty. Most of its resources were used to pay full-time master's level teachers. Other RBHS programs, in contrast, have had faculty who could have been or had been within the School of Public Health. New Jersey Medical School had a Department of Preventive Medicine and Community Health. Robert Wood Johnson Medical School had the Department of Environmental and Occupational Medicine. CINJ had the Cancer Epidemiology program that it was growing as well. So the plan was to move the appointments of these other faculty into the School of Public Health once a new dean arrives, launch a dean search, I'm happy to say we have phenomenal candidates. We have attracted enormously strong candidates for that dean search, including multiple people who are sitting deans at other schools of public health, who've applied to come here because they realize the excitement and the opportunity to build something new and different, and what we could build as a statewide entity, as the only school of public health in this state. Have attracted phenomenally strong candidates. That search is well underway. and that search and then the idea is to move forward with a different model with the new dean, hiring a number of additional researchers as well who will also teach in addition. Continuing on the list, New Jersey Medical School and Robert Wood Johnson Medical School are moving forward with ways to leverage their individual strengths and collaborate. The two institutions have very complementary strengths. And so examples are reorganizing clinical appointments and even joint clinical chairs. So, for example, we already have a joint Department of Radiation Oncology. The chair of radiation oncology here at Robert Wood Johnson is also chair of radiation oncology at New Jersey Medical School. That's a model we're going to be moving forward with in a number of different ways as a series of pilots. One of them is the Department of Emergency Medicine, where both schools have open chairs at the same time. Both schools have had searches underway that have ended up choosing the same candidate. An offer has gone out to that candidate now with the hope that that candidate will become chair in both departments. Department of Family Medicine, extremely strong here under the leadership of Altalia, with the idea of extending that leadership to Newark as well. Neurosurgery and otorhinolaryngology, very strong in Newark, with the idea of extending the chair there to be chairs here as well. Again, taking advantage of chairs in both of the different schools, strengths in both of the different schools, to really build critical masses. These two schools have enormous strengths, but they are each by themselves small. If you add the two together, makes the size of an average school with average resources and average number of faculty. So the schools aren't going to double in size. It doesn't make any sense. And it's very hard, as well as financially inefficient, to try to maintain what you need to maintain clinically in terms of a breadth of covering everything, which you need to be a top medical school, and to do that with a faculty that's really half the size of the faculty at the average medical school. And so integrating between the two and taking advantage of the potential to integrate between the two is a major opportunity going forward. And again, not combining the schools, but looking for ways to integrate across them to the degree it makes programmatic sense. Lastly, designing a multi-professional practice plan for the future, and we've talked about that. Examples of integration across Rutgers: the Brain Health Institute was an institute that was jointly searched for, the leadership there was jointly searched for by Dick Edwards and I, two chancellors, two different divisions, and the new leader there will report to us jointly, though administratively will fold into RBHS. From an administrative point of view, it's truly a joint activity, and with the charge of developing and bringing together neuroscience faculty across the entire, all of Rutgers, and recruiting faculty into multiple different chancellors' divisions as part of that. Neuroscience is a strength for us. It's also a strength in Newark. It's also a strength in New Brunswick, and an opportunity to bring it all together. It's also a strength of the Kessler Institute, which is the rehabilitation department associated with New Jersey Medical School. It's actually the second best rehabilitation hospital in the country in U.S. News and World Report rankings, and neuroscience is most of their research. And so there's enormous opportunity to pull that together as strengths. Biostatistics Consulting Service is another interesting dynamic. Almost every place I went in my listening tour, people complained to me that they didn't have biostatistics help. They needed a biostatistics consulting service. Well, for me, that's old hat. I started one at Penn. And as I began to look into it, it turns out we have 3 already. But obviously no impact on the faculty who don't know that this help is available. And so one of them is in the School of Public Health, one of them is in Rutgers, New Brunswick, and one of them is in in Newark in the Department of Community and Preventive Medicine in Newark. And so we've gotten them together with the idea of putting together a single front-end consulting service for all of the faculty in the entire university, with each of them, so there'd be one web front end that people solicit help from, and then you'd get referred to the right person based partly on geography and partly on expertise, because the biostatistical expertise in the 3 sites is different. biostatistics, epidemiology, study design, survey design, the different strengths and weaknesses in the different places, so people would get referred to assistance across them. And so the three programs are now working together to put together a proposal to me for what will be a university-wide biostatistics consulting service. Next is reorganizing the basic sciences across Rutgers. Obviously, you probably know, as part of the university-wide strategic plan, there's an effort to look at reorganizing all department schools. Should we form new ones? Should we combine them? Right now we have multiple duplicative departments not only across the two medical schools, but to a large degree between some of the biology departments and biomedical departments in the undergraduate schools as well. This is an enormous opportunity. There's really two extremes here. One extreme in many ways is Brown, which has the medical school at Brown University has no basic science departments. It's just the biology department of the undergraduate school that does that teaching. We're not going that way, don't get me wrong, but that's one extreme. The other extreme is probably what I experienced at Penn, where every single school, including every separate professional school, had its own basic sciences. Dental school, veterinary school, medical school, each completely separate. The UMD&J was better than that. In Newark, the schools were integrated. The basic sciences at New Jersey Medical School, basic science departments at New Jersey Medical School taught, for example, the basic science courses for the dental school. That wasn't duplicated. But we have the opportunity to look for synergies across the two campuses geographically as well, especially as we move more to inverted classrooms where kids don't go to lecture rooms, they watch them on the web at double speed. And the faculty interaction is in small groups. Those lectures could potentially be in common across the campuses, with workshops being held for the students separately across the different campuses. We have the opportunity potentially to have our faculty, if they want, teach more in the undergraduate school, and vice versa, as some of the schools, Rutgers Newark, for example, is looking to strengthen its biology. Instead of hiring its own faculty, it potentially could reach out into our basic science departments. So there's an enormous opportunity here really to integrate basic sciences across our three undergraduate campuses and at least two medical schools, which have basic science departments of their own, and strengthen basic sciences across Rutgers in the process. Finally, the roles of centers and institutes. I've got so again, reorganizing basic sciences, creating a task force to work in collaboration, coordination with the Rutgers-wide committee to consider reorganization options within RBHS, to review the missions and activities of all the basic science departments, and consider merging or consolidating existing departments housed in different schools when and if appropriate. Finally, roles of centers and institutes. Until now, as I alluded to before, the centers and institutes have been enormous strengths, but have tended to be isolated. We want to develop and coordinate center-institute administrative policies Rutgers-wide, addressing management issues, establishing best practices, and a business model, and minimizing the perverse incentives and barriers to collaboration which now exist. Right now, the way everything has been structured, the centers and institutes have really been incented to be isolated. And we really want to take advantage of the strengths in the centers and institutes and have them have much greater impact throughout the university. Not losing any of that strength, but increasing the strength by reaching out, increasing the impact, and increasing the strength by including faculty who are not physically in their buildings as well. So as we move to responsibility-centered management, scheduled to go into place July 1st, 2015, we need to make sure that the rules for RCM are dictated by what makes sense academically and follow what academically makes sense, rather than the rules as they currently do, which create artifacts that drive people not to work together academically, which is the rules that some of the rules we're currently operating under. Finally, enabling structures. The goal is to advance institutional stature, faculty development, and the provosts have been very involved and will be much more involved in faculty development efforts and improving facilities. There's a lot of old facilities, particularly in legacy UMD and J, and delayed capital investment that needs investment over time. And again, there's much more detail about each of these categories and the initiatives we're talking about taking over the next 5 years in each of these categories listed in the main document. So finally, let me end with, or almost end, with funding for the strategic plan. Where's the money for this going to come from? First is to utilize, for this year, revenues provided by each RBHS entity to support key initiatives. Some of that for this year was a tax I applied to the entities. Some of it was this year for the first time, within each entity, 5% of their budget is set aside for strategic initiatives. So that's not money taken away from them, but that's money set aside to recruit chairs, for retention, for major initiatives in a way that hadn't been done previously. Second is to utilize university funding when the initiatives align. So for example, sorry, we'll have a Henry Rutgers chair set aside for bioethics, another Henry Rutgers chair set aside for global health. Third is pilot funding to be provided by the New Jersey Health Foundation, and you've all seen announcements of that, both the pilot funding in general and the pilot funding that was particularly set aside for the strategic initiatives. And lastly, new fundraising strategies to be developed by the Rutgers Foundation under the leadership of our new Vice President for Development, who, Susan, do you want to stand up and introduce yourself to everybody? So Susan Dahlberg joined us 3 weeks ago? Labor Day. Been that long already, okay. As Vice President for Development in the Rutgers Foundation, responsible for RBHS. So finally, let me return back to the university-wide strategic plan that I showed you before. What I've highlighted here in red are the areas of that plan that we are covering in our strategic plan. As you can see, it is almost all of it. Obviously, there's some, like improving the health and wellness of individuals and populations, which were obvious and, in fact, functionally delegated to us. But in fact, we are essentially, in all of our recommendations, touching on everything else as well. So I'll conclude. Again, thank you all. Thanks to all of you for participating. Thousands of people were involved. Again, over 3,500 answers to the first survey, 1,500 answers to the second survey. Over 500 people participated in these 32 work groups, which took an enormous amount of time in a very short time period. 24 people put time, particularly in the steering committee, overseeing the development of all of this. This was an enormous amount of work from the faculty at large, coordinated by the steering committee, by Bob DiPaola, chairing it, by Tom editing it all and coordinating it all administratively. And I'm grateful to everybody for pulling it all together. I look forward to working together with you over the next 5 years to make all this happen and make RBHS one of the best academic health centers in the country. Thank you.